Thank you, Honorable Minister, for a very important question of small islands. And if I can give examples, maybe we are talking about Seychelles, Mauritius, Comoros. You face unique challenges such as climate change, limited healthcare infrastructures, and vulnerability to health emergencies. So, if elected, I will ensure these nations receive a targeted support to address these specific needs. First, I will advocate for tailored strategies like strengthening your health system, improving access to essential medicines. I know small islands depend a lot on imported foods. Unfortunately, these are seasoned foods which come with a lot of salts, increasing NCDs. Will focus on training and retention of your workers. But the other thing is an innovative method like telemedicine or artificial intelligence, because you can cater with telemedicine, do consultations with neighboring nations while building your workforce and capacity on health or human resources for health. So you have specific needs. We'll make sure that you get preparedness with all the health emergencies, because you are prone to preparedness like any other country. So prepare on surveillance, which has to start now before the emergencies start. We'll assist recognizing the vulnerability to climate change. So I will support development of climate-resistant healthcare infrastructures, build on early warning signs. And lastly, I'll try to prioritize integrating small nations into larger regional health networks, ensuring you have representations during decision-making bodies, because this is where your voice has to be heard and have the data. Thank you. If I got it to you right, is your representations of the countries which you have mentioned. I think my response will be, if elected as a regional director, one of the first things will be to sit down with the members of the Secretariat, the members who I'm going to meet them at Brazzaville, and see, because we are all aware of the restructuring, reorganization, which is happening at the HQ, and I'm sure we have to get prepared with the 6 regions of the WHO. So I will sit down with the members, see how the organogram will look like, discuss openly with everyone, listen to member states. And I think from there, I will be in a better position to see what you are saying, which is very important, the equal distribution of the positions. We are 47 member states. I think regardless of the size, the economy of your country, this is our organ. All of us has to be there. I know we don't have 47 positions at AGO, but we'll share the positions according to what I'm going to see on the ground. Maybe it's a little bit too premature for now, but what I promise, there will be equal chance for everyone, depending on your qualifications and your integrity. You'll get a position. Thank you, Madam Chair. Thank you, Honorable Minister from Gambia, for a very important question. And if I step back, COVID-19 exposed us how vulnerable and the gaps which we saw. But to me also, it gave us a footprint, a blueprint, to see the deficiencies we have in diagnostic, therapeutics, and vaccines. medicines are very expensive. And we have seen now with the financial constraints we are having in the continent, I think we have to come with the innovative measures. And one of them, apart from increasing our domestic financing, how about pooling our resources, including the small islands which we've just discussed, and do this bulk procurement? We can have a better negotiation of prices, whether with Gavi or Global Fund, when we work, because all we need here is to work together. 2, pandemic accord, which we are going to adopt tomorrow, gives us another chance of Africa. Time has come to have our local manufacturing capacity. Now, while we are trying to do that, why don't we start by 2 things? We have regulatory things which have to be looked after, and we have good examples. We look on Ghana, we look on Tanzania, we look on Egypt. I know it's not in our region. At the same time, we have to build on the workforce. Who is going to work in this? Because, okay, the pandemic accord is going to be agreed tomorrow. So I think it's very important, all these things to go in parallel. Build our workforce, the financing, which we have just discussed a little bit, pool procurement. I think we can, I'm very optimistic that it will reduce the prices, we can get the generics, the patents can be discussed, but we have to start now. And the regulatory, if you see all these countries, they've got level 3, Tanzania now is going to level 4 of regulatory, so we can learn from each other. But the ones which we have now, why we have a ground where to start. I think it's just a matter of decisions. And I think this decision was supposed to be made yesterday. Thank you, Honorable Minister from Central Africa, for a very important question. I think I touched on it, but let me say it again. We have 47 member states with different level of development, different level of economy, different level of challenges. I think among the first things which I'm going to do is to speak with member states. And as I said, our challenges in Africa is not a one-size-fits-all. There are those who they are a little bit farther than the others. So among the things which I'm going to give priority is to try to understand, do a DNA, who has what. I'll give you a very simple example, Honorable Minister. How many member states know that Tanzania does major heart surgeries? How many people know Kenya does kidney transplant? So I think we need to map. We might be having, which I believe we do, a lot of resources among ourselves, and there's no better time for solidarity and working together, not in silos like now. So where I'm going to find deficiencies in Central Africa, maybe in South Africa I can get the expertise. So that exchange of expertise and collaboration, Honorable Minister, will be very important to me. And I think this is how I'm going, because how I'm going to solve or discuss solving with you the problem of Central Africa might be very different from the ones in Burundi. So we'll work together and forge our way forward. Thank you, Honorable Minister. So which one, the rich one or the... No, Honorable Minister, thank you for the very good question. And does the country have to be rich to have universal health coverage? No, let me maybe start by, I firmly believe that primary health care and universal health coverage one, they are inseparable, and they are foundation of achieving an equitable, sustainable health system. So my vision of is just all about planning. I'll give you an example. In Tanzania, we've made a significant stride in this area by having we call it senior advisor on health policy, where we expanded our primary health care infrastructure to underdeserved areas. Because one of the challenges when I was moving around, one thing you have to build on your community health workers, because these are the people who have the trust of the villagers or the underdeserved. They are the people who are communicating with your general population every day. So equipping the frontline workers, like community health workers, and there's other thing which unfortunately is not very prominent in Africa, they call nurse practitioners, because you don't have enough doctors. So if they get training on basic things like immunization, maternal and child health, health education. So these efforts will improve access, but the country has to be rich. My personal experience, I'll say this. One of the things about health insurance, I don't think we've given enough education. You know, I've moved around in most of the member states. You find our members of national health insurance, they are those who are sick. So you have 80% of your members, they are sick people, and only 20% are the healthy ones, and these are the mandatory ones. So I think it's all about health education to our people. They should start getting insurance before they get sick, because it becomes even more expensive for the national insurance, and that's why most of them, they don't succeed. So at the regional level, my priority will be to try to scale up and use some context-sensitive models. And I'll work with you, honorable ministers, so we can discuss. We have got 47 member states with different economies, different population. Talking of Seychelles, 100,000 people. Talking of Nigeria, 220 million people. So each country has to deal specifically
Professor
what
Jacob.
are the challenges and how we can solve them. Health diplomacy and sharing expertise. I will also promote research development in traditional medicine, aligning with the WHO Traditional Medicine Strategy 2025-2034. Excellencies, as I conclude, I stand before you not merely as a candidate, but as a dedicated partner, unwavering in my commitment to our shared vision of a healthier, stronger
Professor
region.
Jacob.
With a proven track record in health leadership and clear vision of continuity, I pledge to serve with integrity and determination. I seek your trust and your vote. Thank you very much.